Confirms more COVID-19 cases. There are concerns that the outbreak could reach schools and public spaces. Well, Grayston Prep School, that's here in Johannesburg, temporarily closed on Monday amid fears of one of its teachers was at risk of exposure. The Education Department has urged schools to first contact health authorities before making such decisions. Well, Basic Education spokesperson Elijah Mhlanga and Satu's Xolani Fagute join me in studio this morning. Gentlemen, thank you very much for your time. Mr. Fagute, I want to start with you. Are there measures at schools to contain this virus? Is there some kind of education to pupils to be aware that there is this dangerous virus?
Well, first, let me greet you, let me greet the viewers as well and the TBE over here. Well, I can confidently say that we believe as a union that currently, no, that is not the case. In actual fact, we called on, during our NEC over the weekend, we deliberated quite at length about this, that there should be quite an extensive campaign to educate the schooling communities, both the teachers and the learners. That should then include the World Health Organization's toolkit in terms of the ABCs of how we can deal with such a pandemic. We believe, though, that the Department of Basic Education will continuously engage us, because we'll be engaging them as well. We have called for the development of such material that can really empower us, because I mean this is a situation that is not quite usual, to be honest.
So you're saying kids basically do not have any measures in place to protect themselves, but nor is education being done for them to be educated adequately around this virus?
Well, like we are saying that currently, as far as we are concerned, that we are still discussing a situation where even the learning material that we require is still going to be developed. I mean, I'm sure that the department will be calling us very soon as well to discuss this issue about this learning material that we're calling for. It is still being in a developmental stage, because remember, Xoli, this is not necessarily a situation that is usual. Yeah. So what we are calling for is for a more of a preventative approach, which is multi-stakeholder in essence. That is what we are calling for. And we're saying that we are looking forward to engaging the department to urgently start dealing with this matter, and we believe that we'll be getting there.
Mr. Mhlanga, how do you respond that there are no measures at schools to either educate children about coronavirus, nor are teachers have any material in front of them to pass on this information to children?
No, the curriculum has hygiene information on it, which is used in schools, which is the same information which the Minister of Health has been talking about and has been reminding South Africans to abide by. And advice has always been around you having to wash your hands and covering your cough, avoiding people who are sick and seeking medical help. That's exactly the same information that has been used in our textbooks in schools. We also have partnerships with other companies such as Unilever, where we have the WASH campaign, where you talk about the preventing of transmission of germs and viruses. It's exactly the same information. So the same material that he's talking about will contain exactly that information, and that's exactly what the Minister
of Health has been talking about. Is it there already, or is it yet to be delivered?
No, it's there. It's there already. It's there already. Remember, it's not everywhere where the virus has been confirmed. So we have prioritized those areas where the virus has been confirmed. And as he said, it's correct, there's going to be a meeting with teacher unions as well as SGB associations to talk to them about the panic which seems to be coming across in our schools, leading to some schools being closed.
Mr. Fagute, are you satisfied with that response?
Well, look, we still emphasize that, you know what, the learning material, we are saying that it still has to be it must respond to the current situation. Now, we're saying that we're speaking of a coronavirus outbreak, right? There might be the material which contains certain elements of hygiene. Of course, we do appreciate that. But the fact of the matter is that we're dealing with an unusual situation. And if we're not going to apply the necessary urgency to deal with it from a preventative point of view, you are likely to see the panic that we feel that is not necessary at this stage.
You talk about urgent measures. Is it practical for a school to first contact the Education Department before making a decision about whether or not school should continue?
Well, we are happy that the TBE has already spoken quite vociferously about that in response to the Grayston matter, for instance. I think the TBE, the Minister of TBE was very clear that this must be done in consultation with the Health Department and then, of course, with the TBE. There are certain ABCs that needs to be followed. There is a certain protocol that needs to be followed. And we are still saying that then that needs to happen. Otherwise, if we do not do that, we are going to find us in a situation whereby we are panicking and it is already happening, and we need to avoid it, and we need to work in a collaborative way to avoid that, even worsening the situation.
Mr. Mhlang, in your view, is it practical for a school to first contact the department before any measures are taken? We're talking about an outbreak, we're talking about an emergency issue at hand.
Yeah, the Minister of Health has said that they should be contacted because this is not an education matter, it's a public matter. And in this case, the Department of Health is the one leading on this matter. They are the experts, is working with a large team of experts who have dealt with similar occurrences before. We know in 2001 and 2 with the SARS thing, it's almost the same thing. So there has to be protocols that are followed. We can't be running around as if we don't have a plan on how to manage these things when in fact systems have been put in place. So everyone must just adhere to those plans and make sure that we all do the right thing.
You talk about places or schools that ought to be prioritized, that are most vulnerable to this. Can I take you to rural schools and ask you the question, how prepared are those schools?
Well, we also need to maybe understand how the virus goes around because it's not something it's in the air. It's not an airborne disease. It's got to do with people making contact with surfaces with other people who are infected. So that's what we need to deal with. So if we understand that, then we understand how we're going to deal with it. That's why we are saying...
How does a school that does not have water deal with this situation?
That's why we are saying as education, we are led by the Department of Health. In this case, where there's no water, we have made this appeal that where there's no water, you will have to alert the district office. They will make arrangement with the local municipality to make sure that water is provided to that school. But we know that most of our schools have water.
Is that sufficient, Mr. Fagut, that a school that doesn't have water must first contact some other department for water to be made available? I mean, it's a recipe for disaster, in my view.
Well, I mean, certainly this day and age, I'm sure the DBE will agree with me that we should not actually be having this kind of a discussion. I mean, basic schooling infrastructure should be there in any case. Basic sanitation should be there. I mean, as a union in education, we are concerned. This is our places of work as well. So, yes, we are correct that, unfortunately, some of the deficiencies within the system, especially in as far as schooling infrastructure, basic schooling infrastructure is concerned, is indeed going to lead us into a not necessarily favorable situation. So we should not necessarily be having this discussion at this stage, but yes, we are concerned, and we will be monitoring, by the way, the kind of interventions that will be coming from the multiple stakeholders, both being the Department of Health and the DBE. But we are still calling for a very collaborative approach about how we deal with this, because it is not a situation that is usual at all.
All right, gentlemen, thank you very much for your time. Goran Fagute from SATU and Elijah Mhlanga, the Department of Basic Education. Thanks indeed for your time.